In the sixth MetaLens series, we'll demonstrate how meta-analysis can help in clinical decision-making. As a clinician, you have a 55-year-old obese female patient with type 2 diabetes. She is eligible for either drug A or drug B, both GLP-1 medications with similar effects on blood glucose levels and no known side effects. To choose between them, you consider factors like administration route and reimbursement. For instance, the patient may prefer an oral drug over an injectable one. 3 months later, the patient presents to you a case control study with 460 participants and 56 reported fractures, showing a 30% increased fracture risk with drug A. Despite this, you decide not to switch to drug B because the study is low quality, with too few events to draw definitive conclusions, and no other studies indicate an increased fracture risk with drug A. Later, a meta-analysis finds drug A associated with a twofold increased fracture risk, and drug B with a 60% lower risk. Initially, this might seem sufficient to avoid drug A, considering the meta-analysis NLQ'd data from clinical trials. However, the small number of fracture events in the meta-analysis means the findings are not definitive. You can discuss these results with the patient and make an informed decision together, considering administration route, reimbursement, and the baseline patient's fracture risk. The example demonstrates the significance of systematic reviews and meta-analyses in the implementation of evidence-based medicine. Making informed clinical and public health decisions requires an unbiased understanding of a subject, which can be achieved through a systematic review and meta-analysis.